Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, the founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can try any course for free at achievable.me, and if you like it, use the code podcast to get 10% off at checkout. Now, let's get started. Today, we've got Becca Güler with us, and Becca, I'd love if you could introduce yourself and a little bit about you.
Hi, I'm Dr. Becca Güler. People used to just call me Becca. I run a company called On Call Advising and Consulting. The secret is the company is just me. I don't even have a secretary, all in one show. But I left the academic faculty world where I was on faculty with a medical school for some time. I ran the academic support and career counseling offices, and I still now work with a lot of medical students, pre-med students, current medical students, and residents as well. I do a lot of executive function coaching, a lot of test prep, helping people with things like accommodations requests as well. And I just have a really big focus on learning. I read a lot of brain science, a lot of neuroscience and the application of that. So I love helping people determine what their specific challenges are as they're prepping for exams, and then coming up with strategies to help them get around those challenges. I wrote Achievable test prep course, so I'm here today to give some tips.
Yeah, I'm really excited for that. And so, whether you're using Achievable's test prep course for the MCAT or a different one, this is really important for getting a good score and just kind of general best practice anyway, regardless of the test that you're taking, even if you're not taking the MCAT. But it's how to review practice exams and then fix your mistakes and improve on your weak areas. So, take it from the top. So, when we're talking about practice exams, well, I told you to take it from the top, but here I am still going. The thing that I think is really important, and we see this a lot even with our non-medical tests, is when you're taking a practice exam, really take the practice exam. Don't have a 30-minute break halfway through. Don't take it untimed and then you take 50% longer per question, but you get them all right and you think that you're going to get a top score. You have to simulate the real testing environment. But once you've taken that test and you've done it in a real testing environment, what are the next steps?
The first thing I want to say, just a bit of a caveat when it comes to practice tests, is that you will get the most out of the practice test and the review process if you
Mm,
take a practice test at the right time. So I
mm,
noticed across all exams, students tend to try to take too many practice tests and take them too close together. So a practice test does simulate the exam, help you get used to the format, help you check your pacing and practice making decisions in a certain, amount of time if it's a timed exam, and unfortunately most of them are. But especially with the longer exams such as the MCAT and the USMLE exams, etc., we also then have a data set. It's our own evidence base that can help us to make decisions about what to go study. And so we want to make sure that we're not taking subsequent practice tests too soon when we haven't actually had time to implement what the last practice test told us we needed to work on. Otherwise, the next practice test, half of what it's going to tell us is the same thing the last practice test told us. So that's a key thing that I think we need to look at. Part of getting what you need to out of reviewing an exam is just taking the exam at the right time when you've actually implemented what you needed to practice wise. For the actual review of the exam, one thing that I really encourage people to do, particularly if you have limited time, which is often the case, is to focus on your incorrects. And the theory that I'm working on here, and just to note that I've worked with hundreds of students on both the MCAT and the USMLE exams, so it's coming from having been through this a lot. The questions that you got correct, we occasionally have just like a shot in the dark kind of guess that's correct, but that's statistically pretty low. The vast majority of the time, we did a lot of things right in order to get it correct. You might feel like it's a guess, but it wasn't a true just guess. You used what you did know or what you did understand, and you used logic and you put it together and you were right. Um, there's not a lot that we can get out of looking at the correct items. So we can get a little bit, but for the amount of time it takes, it's kind of low yield. But with the items that we missed, you will absolutely get something out of every incorrect item that you look at because we missed it for some reason. And maybe we missed it because of content, some facts you didn't know, or a concept that you maybe kind of had some details backwards. But sometimes what happens is not that we didn't know the content, but that we had some thinking issues going on. We felt pressured, we rushed, and we missed some important details we needed, or we made a mistake in the calculation, just like a calculation error, just a math error, not that we didn't know how to use that formula, etc. And so it's really important when you review that you have some kind of basic spreadsheet or something to track your errors, and actually included a sample one that could be used that's inside our MCAT course. But you can certainly, make one on your own as well, just noting like what question, what test form was it, what question was it, and then determining right away, did I miss this because of content or did I miss it because of my approach? Just labeling that. And then if it was a content, what was the content specifically? And I do encourage people to analyze and label, not stop and try to learn it in the moment. You will never get through reviewing the test if you try to learn the content that you missed with every incorrect you're coming across. Just note what it was, move on. And then if it was your approach rather than not knowing the content, then want to think about your approach. Was it that you rushed? Was it that you overlooked an important detail? Or was it kind of an anxiety related thing where we kind of maybe making some assumptions that the test makers were trying to trick us? I sometimes think that test makers forget that there's a human on the other side of the test, actually. So I don't think that they're intentionally like trying to trick you. And those kind of thoughts feeling like they might be trying to trick us can actually make us more hyper aware and encourage us to overthink things, to overcomplicate it, and kind of lead us astray. So let's just assume that they're not trying to trick us. But we do want to get to the psychological side of it and say, was I doubting myself? Was I making it more complicated than it needed to be? And we want to note the behavior that we had there, and keep going. It should be just 2 or 3 minutes typically per item that we missed, to note these issues. And then when we do this with even one exam section, if we have 59 questions, if we miss, say, maybe 20, something like that, we could do this with a couple of sections, have a data set of 30 or 40 items, and then we can start shuffling the data by the reason we missed it, shuffling it by the type of content, etc. And then you can make some informed decisions about what content to actually go dive into and review to really learn it. And then also make some decisions about strategies to help with your thinking process. How do I slow myself down if I tend to rush and I don't need to? Or how do I prevent myself from second guessing so much, or, overcomplicating it? But the key thing is to determine why we're missing it and then to address it accordingly. Then allow sufficient time to work on those things. That is typically going to be probably a full week if we have full time study. And if you're in a situation where you're like working or going to school and studying part time, it's probably going to be a few weeks where you need to implement the things that you saw from that practice test before you sit down and do another practice test.
Yeah, you mentioned a bunch of really important concepts in there. I think it's so important to understand why you miss things, and it's not always because you just didn't know the material. It can be just like approach or other factors. Sometimes it's just a straight up mistake, right? And so it's
Hmm.
important to categorize those things. I'm not trying to just make this an achievable sales pitch at all, but just a couple things. We have a review mode where that it just has you go over what you got wrong, and then a focused mode where you can take a quiz that's basically your incorrect questions. And we also have analytics for each practice exam on what sections of things you got wrong. So just little shortcuts that our course has, and I'm sure other courses have too, but basically just to help you quickly figure out what are the areas you need to work on. And then the key piece, which is harder for a test prep platform to figure out, is the why. It's like I missed it, but why? Is it because I just need to practice the thing? Is it because I got it wrong or the approach was wrong? And yeah, I think both of those pieces are important. It's also important to be tracking this over time too.
Hmm.
And we do analytics like gated by time, but I think also having a spreadsheet and having that much granularity can be really impactful for that.
Yeah. And that actually reminds me of a point that I should have made, which is that you want to review your practice test probably within 24 hours after taking it. Sometimes after taking the test, especially because this is a 7.5 hour exam, you may just be super worn out and not in a good headspace to be analyzing anything when you finish the test. So it's not necessarily that you have to do it right away, but I would plan to do it the following day. And the reason for that is that you're just more likely to remember what your thinking process was while you were in the questions, and that will help you to more accurately determine if it was content or if it was a thinking issue. So that's another key thing, is just do the review process soon after the actual testing.
Yeah, and I mean, the other thing kind of following up on this also is, okay, so you've effectively reviewed what it is that you didn't do well, and how do you then fix your mistakes? And maybe it's different if it's an approach mistake versus a knowledge mistake.
Yeah, yeah, so that's definitely important. So when it comes to a knowledge mistake, one thing we want to do is, when we've kind of got a data set going based on our review, then we want to make some decisions around what are some not one-off kind of mistakes, like I made this one error in this one microbiology area. But we want to look more at, like, okay, I've got three misses that were related to anatomy and physiology. So let me go review that as an area within biology, for example. So we want to try to look for themes in the data so that we get the highest yield out of the review time that we put in. So we can try to, hit multiple related areas at once as we're working on that. And that means that you may need to not just follow whatever chronological order you have practice passages or practice content in. You need to go looking topically for the thing that you need to target. So targeting is a really important element of being able to fill any content gaps that we have. And then when it comes to the approach side, like the thinking and the way that we read and process and approach questions, the key thing is, if it's to do with the way that we process information, something that's really important to try is talking out loud, like thinking out loud. And it's a good idea to even record yourself. It's going to feel awkward, but to try to kind of talk out loud, capture that, even if it's just audio, and then listen back to it later and see what you catch yourself saying. Certainly, if you find yourself moving really quickly, check the time against your thought process and where you are on the clock. That will help you figure out, like, where you started rushing and where you need to slow down. You can make a note to yourself, like, check in at a certain point and remind myself I have time. I don't rush there. And we also can then catch ourselves sometimes saying things like, okay, I feel like it, D, like this answer, this makes so much sense. But maybe if it could be, it might be, all right, these are the kind of statements that are expressions of overthinking. And so it's a good way to catch yourself when we have that recorded. And in lieu of a recording, if you're working with someone one on one, that's a great thing to do in a session with a learning specialist or a tutor or someone, is to actually take them through your thought process, let them listen to it, because they'll have a very objective view of what they're hearing and be able to point things out to you that might just seem totally normal to you and that you don't realize are actually parts of your overthinking tendencies and or the way that you tend to lead yourself astray. And so then you want to come up with kind of like a motto, a mantra, some kind of self talk strategy that will combat what you tend to have an issue with. And so it might be that anytime you hear the word might, or it could be, or maybe, when you
Mhm.
hear one of those words and say, okay, these are overthinking words. I don't follow this path because it's a path of overthinking. I'm taking a step back and I'm looking at the key evidence that I have, and so you may have to actually talk yourself through that. But self talk is a great strategy for those more thinking oriented, like the psychological sides with standardized testing. And I always like to just point out quickly that the way that multiple choice questions are set up, there is nothing natural about multiple choice questions in terms of human thinking. They are not in line with the way that our brains are wired. So it's very unusual for someone to just be naturally good at multiple choice type items. It's more of an acquired skill. And there are some theories out there that people that are particularly good and seem to be naturally good with multiple choice times sort of questions, it may actually be indicative of some pathologies, related to personality and thinking. Like, it might not be a healthy thing. And so know that you're in good company. If you feel like you're not a good standardized test taker, we shouldn't be good at these naturally because they're a convenient way to measure a lot of people at once. That is why they're structured the way they are. They're
Mm.
not structured the way they are because it's a reflection of how we think, and they often are not really aligned with the reality of what you would do in your job. Or like with the USMLE exam, frequently it can be frustrating for us that students have to know a lot of little items and facts from memory that a board certified physician hasn't known for years. They just look it up when they need it. They just look up what's the protocol for
Right.
this, what's the dosage for this, et cetera. And so there's a bit of that on the MCAT as well, where you're having to know it from memory at this point, and you're having to do it in this multiple choice format, which is not analogous with what you're going to do on the job. And so keep that in mind.
Well,
I'm
and
not
it's a
saying
lot
like
more
you
difficult,
may not
right?
be the problem. Yeah, exactly.
You're asked to memorize like basically years of school and have it all in your head at one time, and it's hard. I
Right.
mean, that's why the repetition of studying and of reviewing the practice exams and going through them over and over again is one of the best things to do because repetition is one of the best ways to train your memory.
Yes. Yes, absolutely. The
Yeah.
repetition is important, and we do want to make it meaningful repetition. So not just repeating, but varying the format that you repeat it in can be really helpful. So applying it in a new way, trying to make your own test question in the style of the exam based on the information that you're studying can be a great way to help prepare you. How might this be asked? And trying to come up with potential test questions out of it can be a great form of repetition that's very meaningful because it really gets neurons activated and helps your mind to
Mhm.
access the information from different sides as well.
Yeah. Well, anything else on this topic before we wrap up?
No, I think that's it. I would say most students probably need no more than 5 practice tests. For some, 3 may even be enough. So I think finishing every available practice test out there should not be the primary goal. Testing at the time that you need to, getting the data you need, implementing the data, that should be what drives your practice test strategy.
Yeah, and then actually you reminded me of one more question, which is you mentioned that people take practice tests too close together. What do you think is a good interval for practice tests?
It will depend on if you're doing part-time study or full-time study. So someone who's able to do full-time study, their days are wide open, then where they are score-wise and how much of a gap we're trying to make up, typically a week to 2 weeks is what we're going to see. And then for someone who only has part-time study available, where they're working or going to school during the day, and maybe they just have like a couple hours a day available, maybe a bit on the weekend, it's probably going to be anywhere between 3 and 6 weeks between practice tests.
Okay, great. Fantastic. Well, thank you so much. This has been Board
Absolutely.
Certified, hosted by Tyler from Achievable with Becca Güler. And Achievable has a great online course for the USMLE Step 1, MCAT, PTCE, NPTE, and others. You can try any of them out for free by going to achievable.me.